Oop, you're muted.
There we go. It got buried. Good morning, everyone. Can you all see my screen okay?
Yep.
Look all right?
Absolutely.
All right. Let's move this guy over there. Well, I thought we would take some time, first 15 minutes or so, to talk a little bit about medication conversations and our role as non-prescribers in these kinds of conversations, because I think it sometimes can be a little bit difficult to navigate or to feel comfortable having these conversations and still staying within the scope of practice, knowing how important it is to have these kinds of conversations. So, starting off by thinking that it's not just conversations, medication conversations, not just for psychiatrists or licensed psychiatric medical professionals or nurse practitioners. There are lots of things that those of us who aren't prescribers can do that still fall within our scope. And so that's what we'll talk a little bit about today. But knowing what our limitations are, when we reach our scope and how to defer to the LPMPs and getting comfortable with this. Facilitating these often difficult, not always comfortable conversations. Figuring out how to navigate the idea of involving loved ones and those from the family system early on whenever we can, and also encouraging individuals to really be thoughtful and planful and normalizing for them that it is a big decision, and this is the space where they can talk about some of their concerns. So things that we can do when it comes to these kinds of medication discussions. I think, the first place to start is really talking about how they think about medication, or even how they think about what it might be like to meet with a prescriber if this isn't something that they've done before. Exploring their perspective and trying to figure out what's their comfort zone for these kinds of discussions and going from there. So really kind of identifying their stage of change, if we're thinking in MI speak. Exploring how they think and feel about medication or the involvement of a prescriber in sort of providing them with this safe, unassuming space where, we're not telling that you must take it. We're just open if they want to have the discussion, and sort of starting from that place. I think it's also important to talk a little bit about their historical experiences with medication or with their mental health diagnosis. What has this been like for them? Have they ever had a medication that they didn't do well on and that sort of turned them off of the idea of medications? Or have they seen somebody close to them or heard a story about somebody who had a negative experience with medication? And so knowing the place that they're coming from can be really powerful information for helping us to figure out how to navigate some of these conversations. Finding out what they know or what they think they know about medication. Oftentimes there's gaps in knowledge that individuals aren't aware are there, and there's a lot of misinformation, and sometimes it's not necessarily misinformation, it's misunderstood information. So what are we able to clarify? And what are we able to say? That's a great question. Let's make sure to put this on our plan for when you're ready to meet with the prescriber. And I think most important question is, what does taking medication mean to them, or mean for them, or mean about them? So if I take medication, it means I do have this illness. If I take medication, it means I'm weak. These are really important things that we need to understand from that person's perspective, rather than just, making recommendations without having all of the information. So as much as information as we can glean from the individual and from the family system, which we'll talk about, can really be useful for us as we try to support them in their decision making. A great place to start is the biopsychosocial model. I think it helps an individual understand that medications are a part of the treatment plan often. It's often recommended, but it's not the only piece of a treatment plan, because really the convergence of these three areas, their social part of their being, the psychological aspects of the work that they're doing with all of us, and then the biological piece, including the idea of working with a prescriber around medications. It's where these converge that we really start to see good health and good mental health. And so, obviously a medication is a piece of this puzzle, but it's not the whole part. And this is also a great way to introduce the idea of, okay, so the social bubble, the social circle is a part of what's happening, what's going on in your social life with those people in your environment. How might they be a help or a hindrance? So it's a great way to introduce the idea of involving others to the individual with whom we work, but also it's a great model to kind of put out there, draw, have a copy of, so that we can start having the discussion if family members or loved ones are willing to come to the session, that they can kind of see that medications, aren't the only answer. And I think we see that a lot. If family members are going to come to an appointment, it's the medication appointments because they think if they take this medication, things will get better. And yes, maybe, and probably they will, but there are lots of other aspects to what's going on at home and to what they can do to support the individual in their, the psychological piece, their work with those of us that they can be supportive of. And it really helps them to understand the bigger picture. It also is a great way for us to model how to not jump to a medication change. So I think when working with prescribers, one of the things that I hear most often is, we feel like prescribers often feel like anytime something goes awry, somebody engages in a certain undesirable behavior, or there's a change in their symptoms, the individual and often their family, and sometimes even us as non-prescribers, are pretty quick to jump to say, let's see if you might need more or less of a medication. Let's get you scheduled with the prescriber. And so before we jump to that, or in parallel, while something, we're awaiting an appointment, there are things that we can do to talk with the individual about what's happening in their environment that might be impacting their symptoms, their quality of life, that made them engage in that behavior. Reinforcing for them and family members that not everything is a symptom of the illness. This is critically important because oftentimes, especially family members, if somebody cries or they get, very frustrated and they yell, it's, did you take your medication today? Or I'm worried your symptoms are coming back. Did you take your medication? We got to get you into the doctor right away. And that really can do unintentional damage. And so working with the family about, how that might be perceived, because we all get angry, we all get frustrated, we all cry at different times. That's part of the human experience. So normalizing that an individual can have an illness and can also have these experiences. And when we jump to, did you take your medication? Sometimes it strips them of that part of their humanity. It's as though I can't have the normative range of human experiences. So we just want to watch and model, not over pathologizing, not jumping to medications are the only answer. Also thinking about involving others from their family system. So what might it be like if we had loved ones involved in these medication conversations? What could the help be? What are the concerns? What might the hindrance be, or the impact of that? If they're not comfortable involving loved ones or the people in their network, at the very least, are we able to gain an understanding of the family system's perspective? So what's the what is the messaging that's occurring in the home, or by those that are most important to the person or the most present in their life? If the messaging is medications are toxic, medications are for the weak, we don't believe in, mental illness in general, it's important that we know that, so that we know that when we make recommendations, they might be met with some pushback from the family system. And this puts the individual in a really tricky bind, which can cause more tension and stress for the individual. So we have to figure out what is the messaging at home so we know how to navigate that. Are there differences amongst different family members within the system? So mom says mental illness isn't a thing, don't bring those medications in the house, and dad and brother are really open to the idea. So are they getting mixed messages at home? Who has power or influence in the family system, especially over this individual? So if you bring that medication in the home, you're not allowed to live here anymore, says mom, who is sort of the head of the household. Really just assisting and exploring these discrepancies that are occurring within family systems, including between the individual who may be open to medication and, fears that they don't want to share this information for what the repercussions or the consequences might be with their loved ones. Alignment with values. How might taking medication align with things that matter most to them? And it's not just what matters their values, but also the system's values. Because again, like we were talking about in the last slide, if we make a recommendation to see a prescriber, the private prescriber, makes recommendation to take medication. If this flies in the face of the family's cultural beliefs or value system, they can feel a lot of distrust of the team at that point. We can cause discord. We can put the the individual in a kind of double bind where they're not sure, am I the good patient, or am I the good son? Whose recommendations do I listen to? I have to live with my family, but I want to get well. And so what can this look like with someone? And if we don't have this information about what matters to the family, and what their value system is, and for the individual, we could be putting people in pretty precarious positions. And so it's just important that we have that information so that we can determine how we need to navigate that with the individual. A lot of times it might seem like everybody are there, we're miles apart, we're worlds apart. And so how do you find that common ground? Medication's the only answer, says dad. Medications are absolutely not a part of the treatment plan, says mom. We're trying to navigate this. Where's the common ground? How do we get everybody on the same page? And so sometimes it's a matter of just pulling the walls down and say, you know what, we're not going to agree on how to get there. And that's something we can work on over time. But at the end of the day, we all agree that the ultimate outcome is we want the individual to live a really happy, healthy life, have a good quality of life, and really talking with the individual about what does good quality of life mean to you. There are some things that are common to all of us. Most of us, I think, want to be happy. We want to feel loved. We want to be healthy. But there are some nuances too. And so what does that look like? So, the value card sorting task that we often talk about in here is a great place to start with thinking about, what matters to the individual and what matters to the system. So it's an activity that you can do as a group or with individuals, and then individual family members, and then come together. So that's a great way to start some of these discussions. Once we sort of know the values and what matters to somebody, we know what motivates them. And so that can lead into treatment planning and goals. So how might medications, or even considering medications, or even starting to think about the idea of meeting with a prescriber, impact the individual's quality of life or their goals? How might medications align with achieving goals or assist with achieving goals? And what are the discrepancies between taking medication and meeting your goals? What are some of the concerns? Obviously, throughout this, we've been talking a lot about the importance of having, back and forth conversations with the individual and involving their family member, because, it's really is a shared decision-making process if they choose to take medications or not. And so having the space for them, even before they get to the prescriber or while they're working with a prescriber, to explore the pros and cons of taking medication, and also the pros and cons of not taking medication. What are their fears, their hesitations, their concerns? What are some of the potential risks, and what are some of the potential benefits? And looking at this again from the individual and loved ones' perspectives, because we want to have an opportunity to normalize concerns and hesitations, normalize the ambivalence that they might be feeling. And also it's an opportunity for them to see that we're really being realistic and balanced, because we understand and we'll share with them that, of course, all medications have side effects and come with some level of risk. Oftentimes these risks can be mitigated or minimized. And so if that's one of your concerns, or one of the things that might be holding you back from giving medications a try, why don't we mark this down? And this can be something that you discuss with the prescriber. So again, setting them up for success and effective Q&A and advocacy during these prescriber meetings. The Ottawa Personal Decision Guide, and you'll see on the slides, it includes a medication example. So I've included that as well. But it's really interesting because it looks at 4 sides of a difficult decision. So it looks at the pros of taking medication, the cons of taking medication, the pros of not taking medication, and the cons of not taking medication. And surprisingly, all the quadrants typically have different information. So when you frame the conversation as, a little bit deeper than pro con, it's really interesting to see the responses that you'll get, and that all the quadrants are different. But it does look at stages of change. What's your reason for make the decision? When do you need to make a choice? How far along are you with making this choice? It also helps you weight what's most important. So staying out of the hospital is top tier importance. But also important is that people don't see me taking medication for fear of embarrassment, shame, whatever it might be. And it's a great opportunity to involve loved ones in the discussion. One, they might be able to contribute their reasons for and against the different quadrants, but also it helps them understand the individual's perspective, because, a family is for medication. Sometimes they don't understand what the hesitation for an individual might be, because for them, it seems like a no-brainer, easy answer, easy results. Let's take the medication and see what happens. But this allows for them to really understand the individual's perspective and their hesitations, which can help when they go in to meet with a licensed psychiatric medical provider. If they're present at that meeting, they're able to advocate that these are some of the concerns of my loved one, and we want to make sure that if he were to take this, that either we can assure that he doesn't experience this side effect, or that we can minimize that. And so it really helps them to be effective advocates. If somebody does choose to take medication, talking about the importance of adherence. And so, I suggest avoid framing it as compliance versus non-compliance. And I think in my head, when I think I'm complying with something, I'm complying with the rules that are imposed on me by someone else. When I think of adherence, I feel like I'm sticking to my plan. I'm here adhering to the plan. And so sometimes that can help individuals feel more comfortable because they are in charge of the decision. So if they do decide to take medication, how can we find ways to support their adherence? How can the family system be supportive of the adherence? And what are things that could get in the way or that could undermine or break down adhering to the treatment plan, including medication? And so that you can problem solve before those situations occur. Another aspect is thinking about the importance of tracking or documenting the individual's experience. If they're not currently on medication, it's a great way to get a baseline snapshot of what's going on, versus if they're willing to do a behavioral experiment and try out medication, what does that look like? It's really useful for providers to have this information, especially from multiple perspectives, if loved ones are willing to complete this, and providers can complete it as well. I think it reduces anxieties, especially of loved ones, if they know what to look for. So if somebody starts this medication, what are some of the signs that they're not adhering to the medication, or that there's misuse or side effects, or that it's not working? How long do we wait to see how long it works? And so it can help us look at, signs to look for, but also the benefits. Are those outweighing any kind of side effects or unwanted impact that that's having? When you're setting up a tracking sheet or a spreadsheet, obviously ongoing symptoms or undesirable behaviors are things that we naturally put on a tracking spreadsheet. Something else that's important to include are potential responses to medication. So even things like, I'm most worried that it's going to impact my libido or my energy level. Make sure to include that as part of the spreadsheet. And something that we often forget are positive targets. So desirable or targeted behaviors. So how often, within this week timeframe, did they feed the cat? Did they engage in conversation with their others who live in the home? So including those desirable or targeted behaviors as well. And the last area is really helping them to feel comfortable sharing their experience, because these conversations related to medications can be potentially difficult. They might be anxiety provoking. It might be with a prescriber that they don't know well. And so we can help them with using role plays, helping them prepare questions and concerns, helping them understand the importance of being concise and clear, so we can work together to help them create a document. What is the information is it that they want to share? How do they discuss sort of sensitive or uncomfortable topics like libido? What might be the impact if they play the quote unquote good patient? Yes, I definitely have been adhering just as it's prescribed, if that's untrue. Versus, if they tell the family at home, no, I'm definitely not taking medications, and they are. So what are the impacts there? And if the loved one does want to be involved in these sessions, a part of these sessions, what could this look like? We really want people comfortable asking questions and being advocates for themselves, and advocates for their loved ones. And the things that we talked about today sort of highlight the importance of having loved ones involved in these medication conversations early on, because it does help with them being, more balanced in their perspective taking. It helps them understand what information they should share. It can help them coordinate appointments, because at the end of the day, the goal is always recovery and a good quality of life. And, the goal is the fewest number of medications at the lowest effective dose. So how do they advocate for that, and how do they understand that? So overall, I think there's a great deal that those of us who are non-prescribers can offer individuals and loved ones when it comes to these conversations. And sometimes we might even be more well positioned to hold some of these conversations because we probably already have a strong rapport with the individual. We see them more often than a prescriber does, and we're not in the position of prescribing. So it is, again, the safe, unassuming space. So, our ability to actively listen, explore some of these values, help them to consider different ways to think about medication as an option for them, why it might be useful to involve supportive loved ones, what the utility is in tracking response to medication, that shared decision making, and also giving them the opportunity to prepare for some of these potentially difficult conversations. Um, so, this is obviously not an exhaustive list of all the things that we as non-prescribers can do, but just wanted to take some time today to highlight that there are lots of things that, get us thinking about all the things we can do. So if anybody has any questions or other things that we can add to the list of things we can do, I would love to hear it.